Welcome, ladies and gentlemen, colleagues. The topic of this interview is how can we reach the general practice community in Europe in our efforts to reduce the burden of cardiovascular disease. My name is Arno. I'm chair of the Julie Center for Health Sciences and Primary Care at the University Medical Center in Utrecht and also chair of the ESC Council on Cardiovascular Primary Care. I will be talking to Professor Martin Scherer. He is head of the Department of General Practice in Hamburg University in Germany and a practicing GP, and he's vice president of the German College of General Practitioners. My first question to you, Professor Scherer, would be the mission of the ESC is to reduce the burden of cardiovascular disease in Europe. What is your view, both as an academic and as a practicing GP, what the role of primary care is in this important mission?
Yes, thank you very much for this question and the introduction. The general practice setting is the setting where most of the patients are treated and where most of the patients are recognized and diagnosed. So GPs are important in both, in primary and secondary prevention, as well as in clinical tasks such as early diagnosis and treatment of cardiovascular diseases. And what they also have to do is the management of comorbid diseases. And since multimorbidity and comorbidity is increasing and will increase in future, this task will be one of the most important challenges for practicing GPs in future.
Okay, so you think they have an important task. Now, my second question would be, the ESC has lots of experience and expertise on cardiovascular disease and uses many means to disseminate this knowledge, for instance, through scientific conferences, web lectures, research activities, clinical guidelines. You are aware of many of these ESC products and activities. Do you think that the GP community can actually benefit from these?
Yes, in principle. But if you look at central conferences like that one, they might be interesting for some GPs, and indeed they might be attended by some GPs. But there could be some additional conferences. We have to reach out into the regions, into the countries, and do additional courses, conferences, and meetings. There is an important social component in the knowledge transfer, and so having large conferences is fine, but we need a variety of different formats. And these formats include intelligent software solutions, iPhone apps, website activities, and so on. We have to use as many platforms as we can have, and what we also need is a mutual understanding. There must be a win-win situation between ESC and practicing GPs, between GPs and specialists, and we have to learn about each other, the way of thinking, the way of the situation, and I think the better we know the GP needs in the GP situation in daily practice, the better we are able to adapt instruments of knowledge transfer to the needs of GPs.
Okay, so you think that potentially they certainly can benefit. Do you think there's a mutual benefit that the ESC as such could also, by reaching out to primary care more carefully maybe, more elaborately around Europe, also benefit from input from primary care?
Yes, I think so. Because the GP setting is a very special setting, and there's there's a difference in the situations in different countries and different healthcare systems, and what we have to have in future is to involve GPs more than we do it already, and to learn more about the diversity of the daily practice in Europe. There is the GIN conference at the moment in Berlin, GIN Guidelines International Network, and it has the title Global Evidence International Diversity, and I think that is also a potential motto for the ESC. There is a global evidence, but lots of diversity between the countries, and the more we learn about that, and the more we involve GPs from different countries, we can have instruments which are applicable in daily practice.
Okay, could you say something more specific about, for instance, the collaboration as far as clinical guidelines are concerned? Because obviously there's national guidelines as well. What can the ESC guidelines mean for primary care in Europe?
Yes, I think at this point we also have to do a little bit more efforts. There are the national societies which have their guidelines, and what is one possibility, that is to translate ESC guidelines, to translate the mother guideline and to adapt it to the needs of the healthcare system of each country.
Okay. Finally, my question, and that's a short question, as far as reaching out to primary care from the ESC side and collaboration between ESC and primary care, are you optimistic for the near future, or are you pessimistic?
Yes, indeed, I'm optimistic. But what we have to do is to be very creative in using different formats, like this CVD prevention summary for general practice, developed by the 5th Joint Task Force on CVD prevention. We need things like that, which are usable and applicable for daily practice. And what we also have to do, we have to keep Richard Hall and Jeremy Grimshaw in mind, who said in 2003 that behavioral change, and that is why we do knowledge transfer. Behavioral change is possible, but it needs to have a holistic approach. And there we have to have the social component, social activities, quality circles, reaching out to the GPs, and we have to use a broad variety of instruments and tools of ESC guidelines.
Okay, so optimistic, but there's still a lot to be gained.
Optimistic, but there's still a lot to do. Yeah.
Okay. Thank you very much for your time, Professor Scherer.
Thank you.